The rugged Pilbara region is like no other, with stretching blue coastlines, red desert landscapes, winding waterways and ancient gorges. But the people here also face unique healthcare challenges, with poorer health outcomes compared to those in metropolitan areas. In 2023, a global challenge was issued to reimagine healthcare in these remote areas, and nearly 100 innovators from around the world answered the call. By bringing together our brightest minds in the frontier of emerging technologies, we set out to improve healthcare outcomes in regional and remote Western Australia. Over the past year, our finalists have worked to turn their ideas into real, practical solutions. They've consulted and co-designed with those who live and work in the Pilbara, ensuring that the winning solution truly addresses the community's needs. Let's hear directly from the innovators themselves, the teams that have worked tirelessly over the past year to bring these solutions to life.
The Dermapatch is a first-of-its-kind microneedle patch that can quickly and effectively extract skin cells pain-free, requiring significantly less tissue than a biopsy and is more cost-effective. At the moment, the only way to diagnose skin cancer is via an invasive biopsy. So a doctor will physically go in and cut the tissue out to go for testing. Our solution uses a microneedle patch that only requires a few cells and uses digital genomics to determine if those cells are in fact cancerous. And what we know is that 40% of the time, they're actually not cancerous. So we can reduce unnecessary and avoidable biopsies by about 40% by using our new microneedle patch technology. My vision for healthcare in the Pilbara is I really think that everybody will have access to equitable healthcare, specifically around skin cancer diagnostics, where rural remote communities have high rates of skin cancer, but limited access to get skin cancer checks.
So my solution is the mobile Medikit, which we take on country to deliver on-country care. It's portable and ruggedized, it's got AI technology embedded in it, and it's satellite connected. So Aboriginal health workers and practitioners can go out on country and take the kit with them, and they can go out and do health screening for preventative health diseases.
We know that these communities have a really high rate of chronic conditions like heart disease, type 2 diabetes and renal disease. These occur very early in life and they're often poorly managed, and this leads to the life expectancy gap experienced by Aboriginal people. My vision for healthcare in the Pilbara is to offer equitable care that's culturally appropriate to reduce the risk of chronic conditions and the impact that has on the life expectancy gap.
Hi, my name is Shu. I work for a company called Real Serious Games, and we're working on the project called MetaYarn, which is a shared virtual presence solution for the Pilbara. Our aim is to use this concept of shared virtual presence to connect people in geographically diverse locations. And by doing that and allowing them to meet in a virtual environment and feel the sense of presence with each other, we can enable stronger communication, better emotional responses, and serve as a platform for delivering healthcare solutions in a variety of different formats. We want to enable everyone, even remote communities, the same access to healthcare as people in urban centres have it. And we understand the challenges that they have, and so by using shared virtual presence, i.e. MetaYarn, we can enable that level of healthcare to be addressed or provided to those remote communities.
Life Languages just translates complex medical terminologies into words that the communities use, into the language that they've grown up with, so they can have accessible healthcare. Built in the Pilbara for the Pilbara and to scale globally.
A lot of the work we do surrounds capturing translations to better help patients on their journeys when they speak English as a second, third, fourth, fifth language. My vision for the healthcare of the Pilbara going forward is to be working back there as a doctor, but making sure we have cultural safe protocols within the system and across WA to make sure that Aboriginal people aren't missing out on receiving the vital information that they need to make the health decisions for themselves.
So HighTide is an integrated digital health ecosystem for the people of the Pilbara. The idea is that it can be accessed by health providers, whoever they work for, or by people wherever they may be, to allow connected, coordinated and accessible healthcare throughout the region. It's a digital system that anybody can access so that people can have access to advanced telemedicine care wherever they happen to be, and they can consult with whichever clinicians they need, can consult in real time too, so there's good coordination of care.
My vision for healthcare in the Pilbara is improving access. There are parts of the Pilbara that don't have the same access to healthcare as they should, and improving that access with technology and having integrated technology so that we improve that fragmentation of care. And that means that people in those remote places in the Pilbara can get the same healthcare or similar healthcare or access to that healthcare similar to what we have in urban environments.
The Pilbara Engage project will help to improve the user experience of our diabetes telehealth service by providing increased access to information and allow women to provide information directly to our health professionals in a really easy and simple way. Gestational diabetes is rising faster in the Pilbara than anywhere else in the state, and those women have an increased chance of developing type 2 diabetes, and the children of those women are also at risk of childhood obesity.
So our vision for healthcare in the Pilbara is that everyone in the Pilbara has access to the care that they need, and one way to do that is through technology. Technology is one of the great enablers that we have in our generation. Generally everyone has a phone in their pocket, and if we can put healthcare on the phone in their pocket that helps them and nudges them to better outcomes in their healthcare, then that's our vision. We want to be part of that and move the needle as much as we can through the solutions that we build.
Our project is all about connecting AMS doctors to the patient. So the AMS doctors can now see the full patient medical record from the remote regions.
So Cara Care Portal basically allows AMS clinicians to be able to see information that exists in WA health systems, something that's not been done before.
So currently when a patient comes to the doctor in the Pilbara, the doctor needs to access their records, and sometimes they can't, especially if they're records that are held in one of the metropolitan hospitals. If you can't access those medical records right now and make a health plan for your patient, it can be blown out for weeks and sometimes maybe more, which will impact on the patient's health.
My vision is that it should be seamless. We should be able to access information that's needed without having to rely on a fax or a phone call or an email. They should have it readily at their fingers and ready to go so they can make a bigger contribution to the community.
My name is Angus Turner. I'm an ophthalmologist based at the Lions Eye Institute, and I'm from a project looking at eye screening with AI power for the state of WA. There are many people who turn up with an eye disease that could have been prevented with regular screening. Despite many efforts over the years to put cameras to check the eye into the local clinic, there have been many reasons why it doesn't work, and the biggest one has been a technological trip hazard. Our solution was to use AI to diagnose retinal disease in the eye on the spot. And that really takes all the uncertainty away from the patient and away from the person taking the photo, who used to have to wait weeks for a report. Now they get the answer straight away. The Pilbara is a wonderful, vast region, but needs innovation to provide adequate healthcare for everyone. And the camera based in a primary clinic where you're getting your normal healthcare, helping get a specialist diagnosis on the spot will make a massive difference.
Hi, my name is Esther Oh. I'm the CEO and founder of Agiliate, an adjective meaning empower to work smarter, faster, and safer. Our solution enables clinicians to deliver smarter, faster, and safer virtual care using X-ray vision smart glasses. So X-ray vision stands for extended reality, artificial intelligence, and computer vision. With this technology, a frontliner wearing the smart glasses can see the virtual hands of an expert, let's say from Royal Perth Hospital, come out onto the patient's wound itself to teach the nurse, let's say in Headland Health Campus, how to treat a very difficult, complex case. So we're really excited about what this holds for the future. We believe we can save more lives, we can protect our clinician workforce, and we can truly transform the way that humans see, learn and work.
For the people of the Pilbara, access to quality healthcare means more than just improved well-being. It means peace of mind. The Challenge finalists have shown that healthcare barriers can be overcome through partnerships, innovation, and listening to the people who face these challenges every day. Together, we can deliver the care that everyone deserves, no matter where they live.